listeners of the What podcast, brought to you from the FAMU College of Pharmacy and Pharmaceutical Sciences Institute of Public Health. And that's why we refer to this particular academic unit as the CoPPS IPH. And who more to talk about it than someone who is actually out in the hedges and highways, compelling others to come to the highest of seven hills, if you will, because he has been there, done that. And he's going to share a part of that journey today in the person of my colleague and friend. I will say, even, what shall we say, protege to a certain extent, but he is the Dr. Marvin Scott, who's the Associate Dean of Student Affairs, Student Services. We do it all here in the CoPPS IPH, but thank you so much for being here with us today.
Good to be here. Glad to be here. Thank you for having me.
Indeed. I know it's, to catch him, like, actually here in the Phase 1 West Wing is rare because he'd be out there, y'all. But again, as far as your journey, Dr. Scott, will you tell our viewers and listeners a little bit about what has brought you to this place in terms of when you were a learner here in the CoPPS IPH back in the day?
Okay. So for me, my journey is like many others. When I came to FAMU, I'm the first generation in my immediate family to go to college. And so being able to come here and find people who I could connect with, not just students, but, from advisors who really cared and looked out and help me when I didn't know how to help myself, so to say. So I think that's one thing about being in an environment like this is it's easy to find someone who cares.
Absolutely.
And so then that helps you understand the excellence with caring. But as I went through, I graduated with my BS in pharmacy, came back to school while I was working full time. At that time, I was working 3-4 jobs and going to school full time to get my doctor of pharmacy.
We love a BMW, a black man working, but that's a whole nother show. But anyway, yes.
So I did that. I graduated and with my doctor of pharmacy. I did a residency, and I came back, and Lord blessed me to be able to start teaching while I was still working in practice in hospital. Pharmacy. Wow,
what a journey indeed. And that's not all, people. When I say simplify, does that mean anything to you, Dr. Scott?
Yes, I am a Marine. I've served in the United States Marine Corps, and we actually fought in Operation Desert Storm.
Well, truly thank you for your service as well as protecting, the United States of America. And he's doing it even more now because he's boots on the ground in a whole different way, y'all. I promise. When you're out there recruiting now as the Associate Dean as relates to Student Affairs Services, what messages are you sending to those prospective learners who can come to the Hill?
One of the things I talk about, and I've just had a conversation with a group, I asked them to think about a phone. And if you look at a phone from when I was growing up, it still make the phone calls. At some point, you still be able to put someone on hold and whatever, right? But the difference is the phones today can do so much more. And so you have to look at a pharmacist like that. The pharmacists of today, we do so much more. If you go back years ago, if someone wanted a vaccine, they would go to the doctor or to a clinic. Now you go to your pharmacist. Your pharmacist is the one who's initially giving the vaccine. So the pharmacists of today and the role of the pharmacists of today is so vast, so broad. There are over 100 different career pathways that you can do as a pharmacist. So, that's one of the things we share is that, look, there's a lot of opportunity as a pharmacist. And then also pharmacy is a great pathway to your next. For those individuals who may want to go to medical school, my doctor, he's a pharmacist. And I think he provides excellent care because his knowledge base of the medicines and the disease states, I just feel like is on a whole nother level. And so shout out to Dr. Ross.
Fred Ross, I believe.
Fred Ross, yes. But because I've been different places where other people couldn't figure it out, he could figure it out. But I think that's his pharmacist training as well.
Indeed.
But then, you're going to go to dental school, veterinarian, all of them are better prepared if they get a doctor of pharmacy degree and then go to medical school because they're getting the clinical experience. They're getting disease state management. They're getting all those different things, which sets them apart from a student who's just in biology pre-med.
Gotcha.
Or something like that. So it's a great pathway for your next as well.
Indeed. And speaking of pathways, we've even had some of our graduates to go into law school as an example, but you'd be like, yeah, but when you think about the jurisprudence, the ethics portion of pharmacy, again, I'm always like, I brag on my family pharmacists because, they know me. But beyond that, as relates, Dr. Scott, to your roles in terms of, not only are you out literally going to various venues as relates to recruitment. When you're here, there's a lot that goes on in terms of a student's matriculation or a learner, as we refer to them here.
Mm-hmm.
But the student services, student affairs, what are some of those things that happen in your suite?
So in student services, in that area, we deal with everything from recruitment, enrollment, admissions, enrollment, retention, and graduation. So we have a hand in all of that as aspects. So for us, when a student gets here, making sure the student knows the appropriate areas they can go to get help. If they need extra time on the exam, making sure they know this is the person you talk to. If a person needs an excused absence, this is how you get that excuse process and those different things. We also deal with when students aren't doing well, and the professors, they can email us, and we'll reach out to the students to see, can we help you? Is there anything that we can do from our standpoint that can help you? I'm very just appreciative of the individuals that are in the staff that we have in the Office of Student Services. They're like none other. And I was telling a group the other day, I'm just the paint on the car. You might
these
look
analogies, he's sincere.
I'm just the paint. They are the ones that are the engine, the oil. They are the nuts and bolts that make it work. And they do so much of everything from academic advising to counseling.
Wow.
So we do it all in the Office of Student Services.
Indeed. And I've had an opportunity just to walk through there from time to time, and what he's saying, this is true. We could have some B-roll that would show you some of these stories that are shared, but also in terms of the stories that are shared, I know that you've been involved with several committees here in the CoPPS PH, and I'm thinking specifically as relates to curriculum redesign and enhancement, redevelopment, and what have you, because when you were a learner, fast forward to now, what changes have you seen that are impacting perhaps some of the outcomes that we're striving toward as relates to NAPLEX and licensure, MJPE, et cetera?
There's a couple of things. I just think, one of the biggest things is just being able to shift as practice shifts, as the exam shift, as the requirement shift, And so, that's one of the key things. And not only that, we as of a college, as far as faculty, staff, have to be able to shift. We have to now get learners who understand that they have to shift as well. And it's not just one person shifting or one group shifting. As a family, we must all shift.
Absolutely. And that's why, the tie is here. If you can't see it up close, we're going to kind of zoom in, but he is striking boldly from the top, I might add, just as relates to moving forward. The new year is approaching, transformation is in the air. Your recruitment efforts, how much time out of the office are you anticipating moving forward to get the learners here? And what can maybe someone watching today say, well, maybe I should be part of that family, pharmacy, public health?
Well, as far as travel-wise, we'll hit the ground running in January, probably the second week in January, second, third week, around the 14th.
And is that done collaboratively, with other academic units as far as that goes?
No, some of it is, and then some of it's private visits that I'm setting up because I need to get in front of individuals specifically for pharmacy. And so...
it's personal and professional.
It's personal and professional. It's professional, but it's personal. Yes. So we do that, so we hit the ground running, going to different schools. We have different memorandums of understanding, articulation agreements that we develop. So, like I'll be at Miami-Dade College in the spring. I'll be at Bethune-Cookman in the spring. So those are some of those private visits that we have, but the university as a whole also has other events. Mr. Augustus Mitchell and his team, they do a great job of going out recruiting for us. And then also giving me ideas of, hey, Doc, we're going to be here. I think this would be a good one for you. So, in other words, I'm not just throwing my pole.
Oh, willy-nilly.
In a pond where there are no fish. He does a great job of saying, I think this would be a good one for you. Excellent. Would be a great return of investment. And so I also go and travel with them so I can get in front of the students that way as well.
Relationship building all around. And I'm just wondering, what's some of the feedback that you get from some of the prospective learners? Like when they come to you and they say, "Oh, pharmacy, public health," and Dr. Scott, what's going on? What kind of feedback do they give you?
Okay, so one of the things that initially what we get is like when I'm in a room, I'll give you an example. We were at a medical magnet school, and they asked, okay, how many people want to be doctors? And several raised their hand. How many want to be nurses? Several raised their hand. Then you even had a couple say they want to be physical therapists and occupational therapists. No one there said pharmacists.
What's up with that?
So because, when COVID hit, the focus went from, just pharmacy and all out healthcare it went to nursing, doctors, and to a great extent because respiratory therapists play a major role.
Because if you can't breathe, nothing else matters.
Right, and played a major role to that point as well. But those things, and so because it was just so much out there about that.
Rapid fire.
The attention went to that. So one of the things that I have to do was bring that focus back to, hey, pharmacists was there too. Pharmacists had to still go to work. Pharmacists still had to do their rounds. Pharmacists still had to dispense medication. It's just that, there is another side, and there's so much that we do in healthcare as far as being patient advocates. That's why it's important to have someone who understands what it is to be a minority, who understands what it means to be poor, who, you know what I mean? Because we have several individuals who graduate who come from families who didn't have as much, and now they're in a place, but they understand. So now they are better advocates for individuals who have families in the hospital. I can't tell you how many times that I've been in the hospital with my family. And I give you a quick story if that's okay. I remember one time I had my brother Artemus, he was in the hospital. He fell, broke his hip, and wound up having a stroke. So he's in ICU and he has a consistent tremor. I mean, he's shaking literally like this. Violently all night. So my mom calls me. I get there in the morning because as soon as she tells me that, I pack my clothes.
Okay,
I'm gone. I'm on the road.
Brother love for real.
So I get there first thing in the morning, and he's still shaking like this
from the night before.
So I call the doctor. I go to the nurse's station, and I'm like, "When is the doctor coming in? Because it's 9:00 now, and no one's come in and seen him." Now, I've been here since 6.
Brother feeling some kind of way about his brother.
I'm feeling some kind of way. But to make a long story short, by me being able to intervene, because I was like, well, what medications are we giving him for this? And I was able to say, no, that medication ain't gonna work. That's not for that. Then if there's finally said, do you want to talk to the doctor? I'm like, yes, I want to talk to the doctor.
That's who I asked for when I came to the nurses.
So when they did a talk with the doctor, they wound up getting a neurologist involved, did an EEG, and found out that my brother was having a continuous seizure all night long. Now, if they'd have did that the night before, he would have got been able to get rest. He wouldn't have gone through it all night. The point I'm making is, but I remember after I finished that conversation, this guy that was in maintenance or housekeeping said, "Man, I wish you were here when my mom was in. Maybe my mom wouldn't have died."
My God, I can't.
That's the importance of someone who understanding medicine. You don't have to be the doctor to make a difference.
Wow.
You don't have to be the nurse to make a difference. Being a pharmacist is such a powerful degree, and it gives you so much knowledge and understanding of the different aspects of the medicine and the practice of medicine and what medications they should be on and how they should be treated. It gives you so much knowledge that you can be a better advocate for your patients, for your community. That's the power of being a pharmacist.
Wow, and that passion just popped off of his lips of clay right to you, what viewing audience. So in conclusion of our time here today, Dr. Scott, wellness, healthcare, advocacy, and transparency is what we're all about here. What's a takeaway that you may leave with our audience today in terms of, maybe they know someone or, some kind of relationship, alumni even being more engaged, that you would leave with our audience today, please?
I would leave them that pharmacy is a great degree. It's a great field, it's a great opportunity. I would say this, that individuals who are not happy with being a pharmacist, that's because they chose a career for money. And they're working for money and not for passion. Pharmacy is so vast, so broad, that you can find something that you're passionate about and make the money that you want to make.
A win-win.
It's a win-win. And so I say, if you're interested in going to school and you're not sure, why not strike with us?
And strike boldly, why don't you? For someone who wants to get in contact with you or your office, the best information, email or phone?
Email, and one of the things I do for individuals who are looking to come in as a first-time in college student, contact Mr. Anthony Norton.
Yes.
Anthony.Norton@FAMU.edu. You can also give us a call at 850-599-3016.
And someone will pick the phone up so that you can talk with an actual person here.
Right. We don't have we're real. It was live and in effect.
The mission of recruitment goes on. It is a mission possible. And thank you, Dr. Scott,
thank you for having me.
Leading the realm as the helm as it were, here on the highest of 7 hills. And for you, be sure to like, subscribe, and share the What podcast. Until the next time, stay healthy, wealthy. For your show ideas, of course, ola.sheffield@famu.edu or 850-412-5110. Peace and blessings to you and yours. And thank you.
Thank you.
Yay.
Thank you.
You did it. Okay, I'm seeing the passion.